MCL injuries are some of the most common traumatic knee injuries among athletes. Military service members suffer them as well. In this video, I'll explain what they are, how they occur, and how they can be treated. I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. The medial collateral ligament is a major stabilizer of the knee. If you look at this knee model, it's this big ligament on the inside of your knee. It's the most commonly injured ligament in the knee, especially in athletes and active people, including members of the military. Now, injury to the MCL usually comes about as the result of a specific traumatic event. Minor trauma can do it, especially some superficial tearing, but it's typically high energy mechanisms that fully tear the MCL. Now, the patient, the military service member, usually describes a sensation of the knee giving out at the moment of injury, and then very often the knee will swell up. A lot of times it's a blow to the outside of the knee that opens up the ligament on the inside or opens up the inside of the joint. A lot of times when you go to medical to get evaluated, you're going to have pain right over the part of the ligament where it's torn. And that can be up at the top of the MCL, what we call the origin of the MCL on the top or the bottom part of the femur, or it may be where it attaches on the proximal or upper part of the tibia. And typically, yes, history and physical with the doctor can be enough for diagnosis, but a lot of times that's where we'll get an MRI. The good news is MCL injuries almost never need surgery. They can heal without surgery and physical therapy and rehabilitation. Very significant tears, only occasionally, but some do sometimes need surgery. Now, if a veteran had a traumatic event as a service member, this would be a very straightforward thing, especially if you're still having issues with the knee down the road. A very straightforward argument for an orthopedic surgeon like me to make as an injury that should be considered secondary to military service. And so if that's something you potentially have, I would love to potentially help you in your disability claim. If you have ideas for topics for future videos for this channel, whether it's injuries like MCL tears, risk factors for those injuries, specifics about the process, Nexus letters, DBQs, really anything else, leave those in the comments below. Make sure to subscribe to this channel, click the bell to be notified when I release a new video. If you're interested in a Nexus letter for your injury or condition, click the link in the description below and you can learn more about working with me and my team. We try to make this process easy and to make it as fast as we can for you, and I try really hard to write a Nexus letter that gives you the best chance of success in your disability claim. Thank you so much for watching, and I look forward to helping you more.